right.
Awesome.
Does that work? It's not. Ah, yeah. You can. Everyone can see something
Yes.
on their
Yep.
screen. Awesome. Great. So my presentation tonight is really quite general, hence the title, What Can Clinical Psychology Offer? And also in these times referring to kind of the strange times of COVID we're living in at the moment. I will talk for approximately 30 minutes, hopefully a bit less, so that there will be time at the end to ask me questions. I had a chat with Tom a couple of weeks ago what the focus of my talk should be, and there was some interest in, what different types of therapy. So I put that in as well. I really hope what I present tonight is of interest to you. All right. What will I talk about? I will briefly talk about what is a clinical psychologist and also a couple of other mental health professionals in that exist. Can be quite confusing. Who is who and who does what? So I'm going to talk a bit about what's therapy, why people might come to therapy, common approaches. I also talk about mental well-being during COVID. I think a really important topic for all of us at the moment. I will provide a slide with further resources if you're interested to follow up on anything I talked about, and then hopefully there will be time for questions and answers. Just checking, can everyone hear me okay?
Yes, we can.
Yes.
Okay.
Loud
Awesome.
and clear.
Great, thank you. Thanks for the feedback. So let's start with what is a clinical psychologist. So it is, a clinical psychologist is a registered health professional. So they're registered with APRA, which stands for the Australian Health Provider Registration Agency. I hope I got that right, something like that. That's also where doctors are registered, etc. And the title clinical psychologist is actually protected. So you have to have done about 8 years of training, so including postgraduate clinical training and kind of like a registrar time, etc. And a clinical psychologist is qualified to undertake psychological assessments and also provide psychological interventions, therapy to people of all ages for a wide range of difficulties, including complex mental health problems. And typically you would be finding a clinical psychologist working in hospitals, at outpatient clinics, in schools or private practices, also some NGOs who provide psychosocial services, you would find them there too. And there's probably more places you could find them. I wanted to give a bit, while talking about what a clinical psychologist is, I also wanted to talk about what are mental health professionals out there, because as I said, for a lay person, this can be really confusing, but maybe some of you have already sought out help for mental health professionals, so you might be a bit clearer about these things, but I thought I'd briefly just say that there's a whole range of different people working in this area. And I put a bit of an arrow there, which kind of indicates, the darker end of the arrow, which is on the top, indicates, more training, probably more years of training and more regulations around quality standards in place. And the lighter the arrow goes, it's a bit more vague. And so on the top, we would find psychiatrists. They obviously went to med school and medical doctors. They would have done a lot of study and training. They would have specialized in psychiatry. And they're the ones who can prescribe medication, such as like antidepressants or anxiety medication. Some psychiatrists might have also trained in psychotherapy, so they could provide some therapy as well. Then we have the clinical psychologists. I already talked about the registration and training standards. Then we have registered psychologists. So they're also obviously registered, as it says, with APRA. So they would have an undergraduate training in psychology, but no postgraduate clinical training. And they would have acquired their clinical skills through basically internships. Then we go further down, we talk about psychotherapists. That's really quite a catch-all term. It may refer to professionals trained in a particular psychotherapy, but not necessarily somebody who has studied medicine or psychology. And it is not a registered profession, therefore. And then counselors also a really often used catch-all term for mental health professionals.
I can't hear anything.
Oh,
now I can.
Okay, sorry.
Yeah, can we not do that, please?
It's okay, but let me know if the transmission is interrupted or something. Yeah, so that's a catch-all term. Often people talk about seeing my counselor, but that could mean all kinds of things. But usually you would say a counselor would have maybe a certificate 3 or 4 in counseling, or maybe just a basic training in counseling. You would find them often at crisis lines as Lifeline. They often have counselors. And that's kind of where I also actually started out working in that area. I started at Lifeline as a counselor. And I think, Viviana, you've worked at Lifeline too. I can't remember, as a counselor. So I guess the takeaway message is there's a whole range of mental health professionals, and it really depends on their qualifications, what they can offer. So if you reach out for support from a mental health professional, I really recommend ask about their qualifications and also the areas they typically work in to see whether they're the one that can help you. So what is psychological therapy? Also known as talk therapy. It doesn't involve lying on the couch so much anymore. That's more like what Freud did. Very often we kind of just sit across from each other. And it's really about, like the picture I chose, it's really about helping people to kind of better understand their thinking and how that influences how they feel and act in the world. And so the idea is that therapy kind of helps to untangle and helps to discover how it all fits together in a way. It can be undertaken, therapy can really be undertaken by individual in like a one-on-one situation. It can be done by couples together, by whole families. It can also be in a group, so people with like similar maybe difficulties would attend a group together to learn strategies and get mutual support. And obviously a whole range of different therapeutic approaches exist, and I will talk about them a bit further down the track. So why would somebody go and see a clinical psychologist? So there's obviously a whole range of things somebody would go. And I just present a list of some of the most common reasons. And that's really any kind of adjustment to life changes. So whether this is, migrating to a new country, moving house, having lost a job, retiring, adjusting to a diagnosis of an illness, anything really. Stressful events, adjusting to those. Grief and loss, very, very often people present with that, and that's obviously also an area I work in specifically. Depressed mood, often that can come together with suicidal thoughts. Anxiety, worry, fears, very commonly seen. People also might seek help for addictions. That could be substances, but that could also be gaming or gambling. Sleep difficulties such as insomnia, eating difficulties, dieting difficulties, body image, so maybe eating too much or restricting, or not being happy with how we look, but in a way that it interferes with our functioning during everyday tasks. Relationship problems, compulsive behaviors, that could be like something like nail biting, but it could be also other things. Impulsivity, when we kind of seem to doing something without even having thought about it, and it can get some people in real difficulties, and they might want to get support to change that. Learning difficulties, and much, much more. Mm-hmm. So I want to briefly just touch on mental well-being of autistic people. We know that autistic people, unfortunately, more commonly experiencing bullying and discrimination, whether that's at school or in the workplace or just generally in the community. And it is well documented in research how bullying, what a detrimental long-term effect bullying has on anyone's mental health. And autistic people may also experience autistic burnout. This may be something you're already familiar with, maybe because you read about it, maybe you have experienced it yourself. I will talk about what autistic burnout is in the next slide. And so all that leads to what we find higher rates of mental health problems in the autistic community, and especially depression and anxiety disorders. In addition to that, often there's more neurodiversity. We find a frequent co-occurrence of ADHD or intellectual disability as well, together with autism. We also know there's higher rates of sleep problems experienced by autistic people, and we also know how important sleep is for our mental well-being, and so that can also lead to those higher rates we are seeing around that. So what is autistic burnout? And that is some of the symptoms and some of the reasons that can cause that. And I would also be really interested to hear from you at the end of this, like your experience and what that is like for you, if you're happy to share. So really, this can be caused by sensory overload. We know that autistic people can have different sensory needs and preferences. Dealing with social situations can be a real strain, especially if you also have to maybe camouflage or mask autistic traits. Suppressing any kind of stimming behaviors that are really meant to help regulating often stress and anxiety can also contribute that. A sense of not meeting what other people or society generally expect of how we should be as a person can also impact on that. And dealing with changes, which I think is really topical for COVID. There's been so many changes. Changes are hard for anyone, but very especially hard for people on the spectrum as well. But I'm happy to hear from you your experiences around that. Symptoms of autistic burnout, kind of similar to burnout in general. It's really extreme exhaustion, increased anxiety, depressive symptoms. It can come along with suicidal thoughts, not wanting to live, and a marked decline in the capacity to function for long periods of time. So that could be symptoms of autistic burnout. And if you experience them, it's probably a good idea to do something about it, whether that is seeking professional help.
I have to interrupt.
Yes.
I'm actually experienced I think it's, if you go back say, I think 2 pages, the one that you were talking about.
Sorry, going the wrong direction.
Where is it? Like the one that you were talking about, the burnout, and then before that. So I'm actually experiencing family problem. My mom is being financially abusing me and mentally abusing me. And then when I was at my mom's house, I didn't feel safe. And then that's my anxiety that I can't be in this room because mom have to storm in and then check on me. And then I'm having sleep difficulty. Each time I used to sleep in the living room when I used to live with my mom. And she used to rush in and then check on me every night. What are you doing, Jason? It's that kind of feeling, getting stalked on, which is not suitable. And ever since I moved out, I've been having getting triggered and not sleeping until 4 a.m. in the morning. And at the same time, I'm in a long distance relationship. I know there's I can't remember that word, but I know the awareness in that. Now I'm getting insomnia, I think. I just don't sleep till 7 a.m. 7 in the morning. Because my brain is still actively going through that emotions.
Yeah, it sounds like there's a lot going on for you at the moment. And
I'm trying to handle it, but it's melatonin I'm taking, but it's not enough.
Sure. There's obviously lots going on for you, and thank you for being so open about that. I really want to keep that quite general, but happy if you have any questions about, where to seek help or support, we can maybe discuss that a bit more at the end. Would that be okay?
That would be good. Yeah. Actually, I think I need something.
Great. Awesome. Okay, great. Thank you. Okay. Yeah, I probably also forgot to mention traumatic experiences or anything like that is obviously also a common reason why people would present to a psychologist. What can a clinical psychologist offer to autistic people? Well, similar as to neurotypical people, really, it's what we can offer: psychological assessment. So that means really kind of finding out what's going on. You know, is it depression? Is it anxiety? What is going on? What has contributed to you feeling that way? What has contributed to the difficulties? And of course, the intervention therapy for a whole range of presentations, as I've spoken before. They can also, if they're trained in diagnostic assessments for autism, they can offer diagnostic assessments for autism as well. And they can also assess support needs, which can often be quite important, especially for school or university or workplaces. I work mostly with, I also work with adults, but the most of the individuals on the spectrum that I see are still at school. So assessing support needs is quite important. That can also be quite relevant for India and reviews or participating in NDIS and getting your needs appropriately met. And that's the next point that I want to talk about. Is not just about, this is not just for autistic people. Clinical psychologists generally happy to work with your GP to collaborate and to organize any additional supports that might be needed, whether that is seeing a psychiatrist or OT or physio or dietitian. So kind of collaborating, making sure you get the additional supports that might help to bring about some kind of behavior change or improving your mental well-being. And as I said, for school-age children, obviously, a clinical psychologist would collaborate a lot with the schools regarding adjustments and accommodations, but also very often what they do meeting in terms of interventions around bullying and improving and advocating for inclusiveness, which in my experience can be a very frustrating undertaking, unfortunately. I want to talk about, and I think Tom was especially interested, I hope others are interested in that as well, some really common therapeutic approaches. So they are the things you would find if you would look at a website of a psychologist or psychological practice. These are the 4 therapies I want to talk about: cognitive behavioral therapy, that we also call CBT, acceptance commitment therapy, that is also called ACT, dialectical behavioral therapy, CBT, and schema therapy. I want to say before I go into the different types of therapy, I want to say the most important thing is how the therapist relates to the person, and the particular approach or skills they use is secondary to that. So the relationship has to be there. And so, for example, in my experience, when I'm working with autistic people, I'm trying to attune to their individual needs, just as with any other person who seeks help from me. And for example, I have found that sometimes providing pictures or videos of the therapy space before their appointment can be really helpful to have someone feel settled when they arrive. Or also making sure, looking after particular sensory needs, like removing that ticking clock or dimming the lights, might be also helpful. Providing a visual outline of the session to keep things predictable, and so on. So, talking about CBT, cognitive behavior therapy, this is probably the most well-researched therapy approach that's out there. Basically, the diagram shows the rough model of what CBT is about. It's assumed if we're in some kind of difficult situation or a particular situation that's really triggering for us, we might get some automatic, difficult, negative thoughts. They're going to lead to us feeling some kind of distress. And then they lead to us acting in a particular way, behaving in a particular way that might not be terribly helpful. And that reinforces the negative thoughts we had in the beginning. And so we get stuck a bit in a cycle. And so CBT focuses on changing the unhelpful thinking patterns. So the box is their thoughts. So that's the main thing that focuses on. But it also works with some behavioral strategies. So testing out behaving in a different way and testing out what happens. Does what we worried would happen actually happen? And so that's kind of the main gist of CBT. And the newer evolution of CBT also involves a lot of mindfulness, so being aware of the present. Another very common approach is called ACT, which stands for Acceptance Commitment Therapy. And in the diagram that you see, it's called the hexaflex, but don't worry about that. The really important thing is the thing in the middle, psychological flexibility. So ACT aims to increase our psychological flexibility so that we have kind of a whole repertoire of ways to respond to difficult situations, difficult thoughts, difficult experiences. And that is achieved by increasing our ability to accept those difficult internal experiences, distressing thoughts, beliefs about ourselves that are unhelpful, difficult maybe bodily sensations, like a racing heart, for example, if you feel really anxious, and difficult feelings. And this is to support, again, desired behavior change. For example, cutting down in drinking, stop avoiding situations that we find difficult. And it also helps to identify our values and translate them into some kind of goals that we can act on. And that's where the C comes in, the commitment. So therapy aims to help a person to commit to behavior that is aligned with their values. And in turn, that will improve quality of life and mental well-being. And DBT, dialectical behavior therapy. The dialectical is really talking about finding the middle way, not going to one extreme or the other, but that we always have to stay in that tension of maybe extremes that we experience or that we think. That's really where that name is coming from. The therapy really also, it aims to change behavior. You might see a common pattern now between approaches. It really is about changing behavior. And it aims to do that by improving emotional regulation. So this is really focusing on the emotional part most. And it teaches skills in the 4 areas they're talking about is mindfulness, so being present, emotion regulation, so being able to change our emotions, reducing our vulnerability to really strong emotions, distress tolerance, which is really about very similar to the acceptance that ACT talks about, being able to manage a crisis without making it worse, and interpersonal effectiveness, which is really about how do we maintain and improve our relationships and increase our self-respect. And then the last mode that I want to talk about is schema therapy. So that aims to change kind of the more deep-seated, really unhelpful beliefs you might have about ourselves, about the world, and about others. And that's what they call maladaptive schemas. So that's why it's called schema therapy. And it hypothesizes that those schemas develop in childhood when our needs are not at all or insufficiently met. And that's why I put that hierarchy of needs there as a diagram. So all the different needs that we have, basic needs like eating, drinking, security and safety, psychological needs of belonging and friendship and respect and prestige and accomplishment and fulfillment needs. And any of these needs could have gone unmet and produced a schema. A lot of CBT techniques are used as well. So it's a very close cousin to schema. Lots of creative techniques and visualization might be used. It's really focusing on the emotion that are getting triggered. And so it is really, compared to the other therapies I talked about, a much more long-term and deeper going therapy than CBT and ACT. It's often something a psychologist might do when CBT and ACT does not lead to the desired change for the client. All right. How do you, so if you decide, sorry, I went one too fast. If you decide you want to access a clinical psychologist, how do you go about that? You can obviously just try and find one online. That's fine. But you can also go to your GP and they can refer you under a mental health treatment plan. And that means you can have 20 Medicare rebated sessions per calendar year. So that makes it a bit cheaper. There might be gap fees there, but a lot of clinical psychologists also bulk bill for clients who experience financial stress. How do you go about finding a clinical psychologist? Obviously, you could ask your GP if they have a recommendation. That can be a good way. But you can also go to the website of the Australian Clinical Psychology Association, which is the professional organization representing clinical psychologists in Australia. And you go to the Find a Clinical Psychologist, and you can really search for all kinds of criteria, like what problem area, what therapy type, age group, maybe you want to speak in your first language. If that's not English, you can look for that, etc., where location, and so on. Or you go to the Australian Psychological Society, so that's another professional body that is representing not just clinical psychologists, but all psychologists, so including the registered ones. And again, similar as to the other website, you can search by particular criteria and get a couple of suggestions. So I want to talk now briefly about mental well-being during COVID. So obviously COVID has brought about a lot of uncertainty for everyone. We don't know how long that virus is going to hang around. When are we going to get a vaccine? Are we going to get a vaccine? When, do things open again? When can we travel again? So many things we don't know. We also might have undergone many changes, like lots of us are working from home now, or we can't access maybe some of the activities that usually sustain us or that we're really valued because of physical distancing. That's not possible. Many of us might have also experienced quite a lot of loss, or a job loss, maybe losing their home, maybe losing access to things that are really important, losing connection, maybe feeling more isolated because it is so much harder to socialize or be in contact with the people that are important in our life and that are supportive. And all of that can bring an increased stress, increased worries, increased anxiety, and also eventually maybe we don't feel so great overall anymore. Maybe we feel pretty down. So these responses would be quite understandable to what's going on. And so this is a time where we even have to be more looking after our mental well-being. And I want to talk about how we can do that by trying to find a bit of balance. So maintaining well-being in uncertain times, how do we do that? Really important to do the stuff that brings you joy, pleasurable activities. What do you enjoy? And really be deliberate about maybe even scheduling them into your diary. This is when I'm going to do that because this is fun. And that's really important to boost our mood. Accomplishments. So we want to also make sure we do things that give us a sense of accomplishment or achievement. And that doesn't have to be anything big. That doesn't mean, writing a novel or anything like that. That could be really small things like try a new recipe, do some housework, do a work task, exercise, whatever it is, that just gives you that sense of like, oh, I got that done. Good. Because that is really important. Both of these things are really important to boost our mood. And then obviously a very important connection. Try and stay connected with your friends, your family, with your community in any way possible, like you do tonight. This is wonderful. Like your club continues to meet via Zoom, makes use of this technology. Yep. And that's really important. Or even text more to the people that are really important. And do less is also important. I don't mean by doing less, I mean the kind of doing less where we just stay in bed all day and don't do anything. That's not helping our mental well-being. But it's about don't put pressure on yourself that you should be doing more only because maybe you spend more time at home now. Like don't feel pressure to have to learn how to make sourdough or anything like that. Just acknowledge that living with this uncertainty actually takes a lot out of us. And we might need more rest and make time for that too. So they're the probably 4 important things to look after to maintain our well-being. The other thing I wanted to talk about is just a little strategy, just a little exercise about what can help us to becoming present. What I mean by becoming present is really when we are like our mind is usually crazy busy, and it brings up all kinds of thoughts. And sometimes these thoughts might be about the past or some kind of memories. Some of those might be quite difficult, and they might start bringing up really difficult feelings for us. So in some way, also, you know, we are sitting right here, right now in front of the screen. Somehow our mind is thinking about some other stuff that happened in the past. So we are not really present. Equally, especially with the uncertainty going on, our mind might be going into the future and imagining all kinds of disastrous things, or maybe not even that far, but maybe about tomorrow and thinking about a possible bad outcome of something. And again, so we're introducing maybe worry and anxiety into the present moment, and we're not actually present. And a way of how we can become more present is to really use our senses to engage with what's going on around us. And I would actually like to invite you to try this out together. Now I'll guide you through it. I'm aware that some of you don't like maybe certain sensory inputs, and that's completely fine. So this is not prescriptive. You can do none of this, or you can just say, like, I'll just try out this one sense, or you stop if it doesn't feel good. So it's just kind of a bit of an experiment. So I would like to invite you to try that out, just starting with the sense of sight. Have a look around you and notice 5 things. It can be really anything. You know, I see a big bookshelf with books, for example. So just have a look around and really take in the detail of what you can see. And then use your sense of touch. Notice 4 things you can feel through your sense of touch. So that could be by touching actually something. Maybe you have a cup of water there. Touch it. Really notice what that feels like. Or notice how your body makes contact with the chair or with the bed you're lying on. And just really notice how does that feel? Maybe you notice the clothes on your skin or the air on your face. Just notice that. And then you want to go to the sense of hearing. Try and really notice 3 things you can hear. You might have to take your earphones off and just listen. What can you hear? And if you can't,
my one with hearing, I have to say I have an ear condition. What is that ear condition when you hear tone?
Jaydan, can you talk about it at the end? Let's just go through it. We'll talk about it.
That's what I hear.
That's okay. That's okay. Great. Thanks for sharing. That's okay. And as I said, if there is a sense that you don't like because you have ringing in the ears, you don't have to do that, obviously. You just, you know, and maybe you might not hear anything, so you notice the silence. And then we want to try and notice 2 things you can smell. And that's just like, have a sniff. What can you smell? Or maybe you have something really nice smelling next to you, maybe a candle, a flower, or you can smell your clothes. Just notice that. Or if there's an absence of smell, notice that too. And then lastly, 1 thing you can taste. That could just be noticing the taste you have in your mouth at the moment. Or you can take a sip of water and notice that. What does that taste like? Okay. So that is a strategy. I'm happy to hear from you after. Oops, I'm going too fast. Afterwards, how that was for you. Any comments you have on there, we would be really curious to hear. So just to sum up, clinical psychologists are just one of a range of mental health professionals that are out there. They can offer a range of interventions for all kinds of mental health difficulties, for autistic and neurotypical people. There's a whole range of different therapeutic approaches that exist. And everyone's mental well-being may be impacted by the current COVID situation due to that increased uncertainty. And therefore, it is really important for us, all of us, to look after our mental well-being. For example, with trying to find balance, as I discussed, we're trying to also get present, maybe like with that exercise we just done, when we have a lot of difficult thoughts coming into our mind. And if you think you're struggling, contact your GP and maybe get a referral to a clinical psychologist. So here is a range of resources that I thought may be of interest to you. So the first one is really, if you want to learn more about the different therapies and how effective they are, there is a nice document available by the, I think it's by the Australian Psychological Association. Psychological Society, sorry, so many acronyms. There's been a really, I saw a nice article on Psychology Today about how to manage autistic burnout, if you want to read a bit more about that. There are anyone who wants to try out CBT, there's some really good self-help resources out there that are for free, that you can work through at your own pace. So the Center for Clinical Intervention, which sits in Perth, they have a range of really well-resourced and designed workbooks for all kinds of things: insomnia, stress, worry, anxiety, mood issues, that you can access for free from their website. And then the website called Psychology Tools has developed a resource specifically for these COVID times in terms of how we can deal with worry and anxiety in this global uncertainty. And there's also online therapy available. So if you're interested in trying out online CBT, sometimes that can be more convenient. You don't actually have to go anywhere, and it doesn't involve as much interaction. There's some guided online courses available on the website that's called This Way Up, and that's programs that are developed by St. Vincent Hospital and UNSW, and MindSpot, which is being developed by the Macquarie University. And if you want to find a psychologist, you can go to the two websites that I talked about before, and these are the two links. If you need urgent help, there are some crisis numbers out there: Lifeline, the New South Wales Mental Health Line, which can also then link you in to support. Beyond Blue is also another really good crisis line to call. These are available 24/7 every day of the year. And then if you want to contact me, here is my email address for my practice, hello@heartandmindpsychology.com.au, and then also my webpage if you want to find out more.